Hey, everybody. Lori Goldman. Thanks for joining us on another episode of For the Sake of the Argument. Our guest today was 47th House District Carrie Rheingans, who is in her second term in the House. And she talked to us about the challenges and talked to us about different options for healthcare and how it's all going to shit. And I just was reminded they don't make very much money. So there's that. But I think we have to learn more. Every time, every day, we have to learn more about our government, how it runs, who the players are, so we can make better choices. And yes, I mean you and me. We have to make better choices who we put in government, whether it's in our city councils, in our state legislature, or in Washington. It matters who's running things. And I'm kind of tired of the way they've been run now. So keep tuning in. You can check out For the Sake of the Argument on all social media platforms. And I hope you do. Peace out. Welcome to For the Sake of the Argument, State Rep, House District 47, Carrie Rheingans. Thanks for coming today.
Thank you so much for having me.
I really appreciate that you're here. You had to drive. What is the district, House District 47? Where's that at?
It starts in downtown Ann Arbor at Liberty and Main. It is included in the district, and it goes all the way west and borders the city of Jackson. So it's geographically mostly rural, a lot of the Irish Hills in southeast Jackson County and western Washtenaw, but also includes some suburban areas like Scioto Township and Ann Arbor itself.
So you don't have any parking that you can get in Ann Arbor, but you got plenty of parking in the rest of the rural part of your district.
Yeah, but you can
Thank
park
God.
in Ann Arbor if you know where to park. And what time to be
sure you can. All right, already starting with a lie. No, I'm just kidding. Teasing. All right, I'm compelled to ask you, you've got an upside down flag on your lapel.
Yes.
What does that mean?
Well, this is my dad's old flag pin. He died last month, and I picked it up off his dresser. And when a ship is in distress, it can turn its flag upside down. And I think, this is a really good description of our country right now. We're in distress.
I agree. And I'm very sorry about your dad's passing.
Thank you.
So one of your top issues is MiCare, a statewide universal health care policy for Michigan. Can you explain what MiCare is, why it's necessary, and what's it going to do for Michiganders if we can even get it passed?
Yes. So MiCare in the Michigan House right now is House Bill 4407. I introduced it early last year. It's the second time I've introduced it. It would provide health care, publicly financed health care for all 10 million Michiganders out of the MiCare Trust Fund. It would pay for medically necessary expenses, and individuals in Michigan would not have to pay a monthly premium. There would be no copays, no deductibles, and no annual lifetime limits.
Is this single-payer health care, or is this a public option? And what's the difference? Because I have to tell you, after talking to a million people, I still don't really know.
So a public option is one of many options that a consumer could purchase. So part of the complexity of the healthcare system right now is that there are so many payers. Medicare, Medicaid, public payers, or private insurance that people get often through their jobs. And so offering a public option that people could buy into is just adding one more level of complexity, really, adding another plan. Single payer or Medicare for all style plans would be only one payer. So it reduces that complexity. That means providers don't have to contract with 11 billion health insurance companies. They don't have to get on the panel and in-network for all of those insurance companies. So that, providers really would love to see a more simplified payer mix. So MiCare, the intention is for it to be a universal single-payer, publicly financed system in Michigan.
And that would be more affordable, right? If they took out all those layers?
Yeah, you would save a lot of money on administration, and part of that would be paying all the people who work in all those multiple health insurance companies, including CEOs like Blue Cross that made $18 million last year. So every one of those dollars that CEO made was a dollar that didn't get paid out in health care for somebody.
Wait a minute. The Blue Cross CEO had a salary of $18 million?
I didn't say that he had a salary or that there was a salary of $18 million. It's was paid that much. There's other options for.
Oh, I see. Bonuses and I got trips on the presidential jet. And what has the Michigan legislature done to handle the massive cuts to Medicaid and increases to health care premiums caused by Congress last year? And what more must be done if, again, we can?
Well, so back to the second part of your first question about MiCare, it is not likely to go anywhere this term. It
Sadly
didn't go anywhere last term. When we had a Democratic trifecta in Lansing, I was actually told not to introduce it because it then would be said that Democrats introduced socialized medicine. And that's when I realized, oh, even my own leadership doesn't understand that having a public financing system is not the same as socialized medicine, where, the staff and employees and all the healthcare workers are employed by the government. That's not what we're proposing. We're just proposing to pay for things differently. And so we never got a hearing or anything last term. This term, the speaker has sent my bill into a committee to kill it, knowing that we would never have a hearing on this term. So that's why I've been doing town halls all over the state, talking to people about what is MiCare in, single payer healthcare. Now, I do think in the next couple, 3-4 years, we will have the full collapse of our healthcare system, which is in process right now. We're already seeing the adverse selection death spiral in people purchasing health insurance. As the premiums go up every month for people, more and more healthy people choose not to get coverage, and more employers choose not to cover their employees or to limit their hours so that they don't have to be forced to cover them. And so as more people get off insurance, the rest of them have to pay more in order to make the math work. And then even more people will fall off. And we're already seeing that happen. We're already seeing closures of hospitals and clinics and service lines across the country and even here in Michigan. So last year in 2025, during our budget negotiations, which dragged on many more months than they should, because our speaker was new. He didn't really know how to do that job. He just thought he could do it all himself. And turns out he couldn't. And he dragged it on way more months than it needed to. But he was the only one that hadn't done it before, right? Our Senate Majority Leader had worked on that, and so had the governor for years before that. So, he didn't really know what he was doing, bless his heart. So he made it take a lot longer than necessary. But part of the negotiations were to decouple our tax rates from federal tax rates in order to change how we do some taxing. It's like a very technical thing, really boring for probably your audience, but we did make a change that allows us to do some taxing differently that will protect how we finance our state portion of Medicaid. You may remember Medicaid is a federal and state partnership that covers low-income people. It covers about a quarter of people in Michigan. And so we had to be really thoughtful about how to try to protect that. That being said, there are thousands of people in 2026 who have chosen not to get individual coverage because they can't afford the premiums since those enhanced Affordable Care Act tax credits were not renewed. That's just the latest. Well, that was the second to last piece of sabotage that the Trump administration has done to the Affordable Care Act. The most recent act of sabotage in the over decade of sabotaging the ACA is to really push for these skinny, catastrophic plans and really push those forward. You've been hearing more about that in the news. And those
catastrophic plans just mean if you're in a horrible car accident and your life is waning, that they'll treat you in some way.
Well, I mean, if you're in a horrible car accident and your life is waning, you go to the emergency room where by EMTALA law, you are required to be stabilized as much as you can. So, and then that is maybe covered, maybe not, depending on if you have insurance. So that is a specific thing. But a catastrophic plan is if you have cancer and you pay your $10,000 deductible, you can still get coverage after that, and you don't get primary care visits covered or anything, but you might be able to get the really expensive treatment that you need. Instead of it costing $120,000, it might only cost 10 or 20.
Which people don't even have 10. I mean,
correct.
Yeah, I don't know if people that support Trump and his policies are apathetic or stupid or both. I don't know
if I would say that they're necessarily either. I think that they really, a lot of folks that I grew up with in rural parts of Michigan, I think, wanted to find something to believe in. They wanted to find somebody to shake up the system. They believed that he would lower costs on day one and that he would end the war in Ukraine. But I think one of the hardest things for humans to do is admit when we might have gotten something wrong.
Hey, I get it. And you're an elected official. Again, I am not. And I will tell you, it is the height of ignorance for people not to figure out and learn what is in their best interest for themselves and their families. And I see no evidence of this hero worship that keeps going on being based in anything but that.
Or misogyny.
Yeah, or
Racism.
xenophobia. Yeah.
There's
Let's go.
some other.
All right. In early February, you introduced a resolution in the Michigan House to call on Congress to impeach Kristi Noem.
Mm-hmm.
What in God's name made you do that? And what happened to the resolution that you put forward in the Michigan House?
Well, it was a resolution calling on another body to do something. So those always get sent to the committee where things get sent to kill them. It is also a place where things could get fast-tracked, but I'm assuming it got sent there to be killed, not to get fast-tracked. But we didn't have a vote. It hasn't been voted on in committee. There's no discussion on whether we should call on Congress. Obviously, I think if you've followed any of my socials, you'll know that I think that ICE is completely out of control. And Kristi Noem overseeing DHS and ICE, I think, is horrible at her job, never should have been confirmed in the first place, and I think needs to be impeached. So I can't do that as a state lawmaker. So we're calling on our federal Congress members to call for that as well.
Quick question. When these resolutions get sent to die, like the land of misfit toys, you're too young to have watched that.
I do know that is.
So nobody ever gets back to you? Like when you put something forward and it gets sent to that committee, it's just radio silence. There's never any resolution. We did this, we did that, unless it goes forward. You don't hear about it or why.
Yeah, so there's a lot of behind-the-scenes politics that happens here, but like the speaker really can decide what gets hearings and what doesn't.
Yeah.
It's not really the committee chairs. The committee chairs can ask for hearings for things, and sometimes like the Committee on Government Operations, kind of anything could fit in there, right? Because we're part of the government. But a lot of things get sent there so that there's no general public push for hearings, like if it went to a judiciary committee or something else. So I think that this was specifically sent there to kill it, not to
That's why who we elect matters.
That's right.
Even within the Democratic purview,
even
it matters.
within the Republican caucus who voted for this speaker, and now they're all unfortunately having to defend some really harmful things that have happened that have been the sole decision of the speaker.
But they're so good at it, so I'm sure they're not having a hard time. How they sleep at night, I don't know.
There's going to be far fewer of them next time.
I hope so, if there's a God. All right, Congress, as of this recording, Congress has yet to act on DHS ICE funding. Do you think Democrats should focus on reforming or abolishing ICE?
I think we should abolish ICE. I've been very clear on that. I was in undergrad when ICE was formed in the way it is now, when DHS was created, the Department of Homeland Security. I remember writing a paper in a political science class saying we don't even need the Department of Homeland Security. Can we not? Like, there's other agencies that are doing this. So I have been opposed to that since 2003. And I think ICE should be abolished, and, you know, to do the civil law enforcement that needs to happen to enforce the civil infraction of certain immigration violations. I think you don't need like a militarized force the way ICE is masquerading to be, and literally masquerading. Like, it's just unconscionable. I'm really thankful for Rep. Kofia for introducing a bill last summer to unmask ICE here in Michigan. And there's been a whole litany of bills that a number of us have introduced trying to fight back against ICE.
Well, I really like to call it, instead of militarized, I think it's more of a militia. It seems to me more of a militia.
Well, and you remember the Second Amendment of the U.S. Constitution starts with a well-regulated militia.
Well, we can't have everything, apparently. Can't have nice things. What do you think the Michigan legislature should be doing to protect Michiganders from ICE? And are they doing it? I know you just talked about the demasking.
So when I go on MiCare town halls and when I'm in my district or around, nearby my district, what I hear people saying is they want us to use the tools we have to fight back. And they understand that we didn't get drafted into military service, so a lot of constituents aren't asking us to literally go out and take a bullet by ICE. They're not asking us to do that, but they're asking us to do things that only 148 people in Michigan can do. Introduce resolutions calling for action, introduce bills, be a public speaker, go everywhere and anywhere to denounce ICE, denounce this lawlessness. And so some of us have been doing that. I think more people should be doing that, but I think people are starting to find their voice and really believe what they're seeing with their eyes and hearing with their ears. It took a while for some folks to start speaking up, but I think more and more people are, and more can.
What are some other policy areas you and your colleagues are focused on right now?
Well, Rep. Pahutsky has introduced a bill to require the governor of our state to approve the deployment of another state's National Guard into our state. That, of course, was sent to a committee to kill it. I introduced a bill to ban those 287G agreements, which are an agreement between a local municipal law enforcement agency and ICE for that local law enforcement agency to coordinate and assist. I'm proud of my Washtenaw County Sheriff for saying she'll never do that. Unfortunately, my Jackson County Sheriff is the first one in the state to have signed one of those. And I think they should be banned because it makes locals do more than they are funded to do. It's an unfunded mandate, and it erodes trust with the local law enforcement versus this, militia, military, ICE. We've also had folks introduce bills to protect protesters. Rep. Myers-Phillips and Rep. Pahutsky just introduced a bill to make sure that protesters are protected from, civil disobedience or civil unrest claims. I've introduced bills to codify the Fourth and Fifth Amendments because for some reason those continue to be violated at the federal level. So I think that they're good things to protect our people against illegal searches and seizures in the Fourth Amendment, and then protect due process in the Fifth Amendment. So I think we should codify those in our state. And there's more things that I'm sure we're going to have to introduce. I mean, it's pretty outrageous that state lawmakers are thinking we have to put an extra layer of protection of the U.S. Constitution in our state law because the feds aren't enforcing the federal Constitution.
And does our state law trump, I hate using that word, federal? I mean, the ICE agents that are coming in at the issuance of the federal government, whatever laws we enact, to protect legal protesters, et cetera, can they override that?
No, so a state doesn't preempt the federal government like that. However, if a federal agent is committing a state-level crime, they can be tried in state-level courts.
Okay, all right, that's good to know. So much to know these days. It's exhausting.
It is.
And let me ask you about your seat, your House District seat. Is this your first term or your second? And I'm sorry, I don't know.
That's okay. It's my second term.
Okay. And remind me, because I forget so much these days, you are allowed to have 2 terms in the House?
Nope.
Or can you have more? And there's like some kind of math that's involved.
Yes. So in 2022, voters in Michigan chose to pass Prop 1, which included kind of 2 main parts. One was a change in the term limits of the legislature, and the other was more transparency required of state-level electeds. So the terms now, you can do up to 12 total years in the state legislature. You could do 3 4-year terms in the Senate. You could do 2 2-year terms in the House and 2 4-year terms in the Senate. You could do 6 terms in the House.
As long as you don't exceed 12 years.
Correct. Correct.
In service. And then, gosh, what happens then? Withdrawal? What do you do after that? You have to run for Attorney General or Secretary of
I'm
State?
not qualified to be the Attorney General, so I would never do that.
Wait, I've never heard someone in politics say they're not qualified. I love it. This is refreshing. Good for you.
Well, I think somebody with a law background should be our Attorney General.
No, you think? I agree. Okay, this is good.
Yes,
this is good.
I have a public health background, so I could stay in office for another 4 terms after this if I so choose, and then after that figure out what's next. But I taught at the University of Michigan before I was elected. I worked for the State Department of Health and Human Services. I'm not worried about my future job, and I think that's how it should be for us. I know when we had a term limit of 3 2-year terms in the House, when people were in their second term, I'm right now in my second year of my second term, they started trying to figure out what their job was going to be next.
Yeah.
Because they might have one more term left. And so a lot of folks go into lobbying or consulting or some other law, state lawmaker.
Noble field, yes. Okay.
Adjacent thing.
So, all right, let's lighten it up a little bit. What do you think the best food spot is in Ann Arbor or even House District 47?
Oh my gosh, there's so many great choices.
You can give us a few.
So I happen to like Zingerman's Roadhouse.
You have great Indian food in
do.
Ann Arbor.
Shalimar on Main Street is in my district. I'm thinking of the district lines right now.
Oh my God, it's almost lunchtime. I'm starving. I have to think of this. All right, listen, tell us a couple unique challenges that the average Michigander might not be aware of working in Lansing. And if you want to make it spicy, make it spicy.
Unique challenges of working in Lansing.
Yes.
Well, especially a minority, you never know like what time you're going home. So I have a 9-year-old at home. I live about an hour commute from Lansing, so I can commute home every day. So sometimes, she was 6 when I started, so it's nice to know when I'll be able to be home if I can help put her to bed or whatever. So that is a rough thing about not knowing your hours. Another unique challenge is just how everybody assumes that the only reason you do something is because you're going to get ahead or benefit from it.
Wow, yeah.
Like I recently spoke to a Republican House member about a committee hearing he was going to have because I was interested in the topic and I might want to testify and work with some community stakeholders. And he was like shocked that I was just being nice and helpful.
Oh, that's sad.
It is sad.
So, yeah, and I think we've broken down our whole system. Working across the aisle doesn't mean caving in on things you morally believe in, but it means when things can be agreed upon or things can find a happy medium that you guys that we send to Lansing and pay your salaries are doing on behalf of us, Michiganders. All right, last question.
And one last thing. I'm so sorry.
No.
The last thing I'll say that's a unique challenge is we don't get a raise unless we vote for it. And it's politically bad to vote to pay yourself more, but we have not we actually get paid less than we did before the economic crisis. Then they reduced our salary, and now it hasn't kept up. And so it's not a very high-paying job, the amount of hours.
Well, honey, hasn't anyone told you make your money on insider stock tips? Come on, and selling influence. If you have a few minutes after we're done, I'll tell you. I was just looking at my news feed before you got here, and if my teeth are chattering, it's because the heat is out again in here, so I can't feel my limbs anymore, but I'll try to make through. Anyway, I was looking at my news feed, and there is some site, I don't remember it. Guys, what's the name of the site where you bet on shit that's weird? Like Polymarket, when we're going to go to war with Iraq. And guess what? A handful of people connected to the Trump family guessed the right day. Some of them bet 87, made $500,000. This kind of shit's going on all the time. So you should make more money. You should make enough.
I'm not going to make it that way.
No, not that way. But I'm saying you should be paid a living wage as everybody from the people that work at McDonald's and support their single family households should, all the way up to, people doing bigger and bigger things. What do you make? What do you make, by the way, if I can ask?
It's about $72,000.
Holy cow!
Which is a livable wage, for a single person.
Well, a single person with no children.
Yeah,
and,
my husband is a
and
trauma
and
therapist.
no Comcast.
Right.
Yeah.
My husband's a trauma therapist, social worker, so you can imagine he doesn't,
Yeah. No, it's kind of crazy. And people fight for these jobs. I don't get it. All right. Last question. You ready? All right. Who is the most irritating legislator in Lansing, and why is it Matt Hall? I don't write these. I read them.
That's really funny.
Isn't that funny? Probably
so
true.
He would love us to name him the most irritating because he likes to think that everybody in the world is just talking about him. So
Yeah.
bless his heart. And I don't know if I would say that he's the most irritating in Lansing. There's other people who are irritating in a way that they would love for me to talk about them because they are only there for their ego.
Yeah.
And recording videos from the floor, and they're not there to actually help
Oh,
people.
yeah. Well, big surprise there. All right. I want to tell you thank you so much for being here. I said your name properly, so I'm very happy about that. But Carrie Rheingans,
Yes.
House District 47, keep on kicking ass and being who you are, true to yourself. The people of Michigan, thank you.
Well, thank you so much for having me on. I love listening every week, and you have great guests.
Thank you so much. Have a great day.
You too. Thanks.